Hi, everyone. It's Christine here, prematurity prevention health educator. And I'm joined today with Melissa Fox, the Chief Operating Officer of Ascenda Health. So, Melissa, how are you doing today?
I'm doing great. I'm so glad to be here to talk to you about this. Feeling good, feeling really excited about this launch. So, yeah, glad to be here.
Absolutely. And Melissa, I'm feeling those same vibes. We are just coming off of the Maternal Experience Survey launch. We had it about 2 weeks ago, and I just want to gather some thoughts about that recap and what happened and your thoughts on everything. So let's talk a little bit about that. So, Melissa, if you could, for those who aren't aware, could you tell us a little bit about what the Maternal Experience Survey is and why it's important?
Yes, thank you so much, Christine. So this is important for a number of different reasons. I mean, we've all heard the statistics over and over. We have, Black women are 3 to 4 times more likely to die as a result of childbirth than their white peers. This is nationally an issue. In New Jersey, we have a particularly egregious situation because that disparity gap doesn't seem to be closing the way that it is in some other states. So all of those women are dying. 60% of them we know are preventable deaths. So you're talking about an impact, not just to the individuals, which is tragic enough as it is, but it's talking about the impact to the communities, to these families. I mean, it has such a widespread effect. And to know that these losses of life are occurring when it should be connected to something that's one of the most beautiful things that we can experience is a tragedy. So the Maternal Experience Survey is going to be the first time that we have the ability to collect real data from women across the span of their maternal health journey. So from the very beginning, the prenatal to all the way after birth and when they go home, we will be able to collect information, not just kind of quantitative type, hard data, but also their feelings. How were they greeted? What kind of reception did they receive? Was there an openness to their support system they wanted to bring into this journey with them? What are those types of trends that we're seeing that they experienced, and then use that data and be able to provide it back to the real stakeholders in the community, the care providers, and then allow them to use that information to make the changes that they need to. Because at the end of the day, I truly believe that we all want the same thing. We all want these women to have healthy births. We all want these babies to come into the world and live to have wonderful, productive, fruitful lives for many years. So, since we're all on that same page, collecting this data is what's going to give us what we need to be able to close that gap because we know we can do it.
Absolutely, we sure can. And as Melissa stated, we want those poor outcomes, those maternal deaths, any childbirth deaths. We want that to all come to an end and come
Right.
to a close. And this survey is going to empower mothers to actually be able to share their stories and to be a part of that change. So, thank you, Melissa, for answering that. And we also wanted to talk about the launch. So that launch we had, I'll say it's almost been
Yep.
about 2 weeks, and we're still on that wonderful, great feeling from the launch,
Yeah.
carrying that momentum.
Yes.
And one of my favorite things that you said, and I don't have the exact quote next to me, but you said, "Now is the time. Now is
Mhm.
the time to make that change." And can you give us maybe some more highlights of how you felt?
Amazing. It was so wonderful to have all of these people who, locked arms to be able to move forward and address this issue. Kaleem Shabazz, he was really spearheading the entire thing. He kicked us off with some really strong words of encouragement. His passion for this cause is unmatched. I mean, I truly believe that this is, his heart, his soul, and his time he's put into it. And for him to bring us all together through the BIMM task force to be able to move this forward is just a wonderful thing to be a part of. I mean, it truly does feel like a history making moment. And there was another moment during this launch, and I'm not sure if anybody's seen it. If you haven't seen it, you got to get the link. But
Yep.
our good friend Cheryl Hackett got on there and she provided the historical context for the situation we're seeing today, for the tragedy and the disparity that we're in today. She provided a wonderful historical arc so that we know why we are here. And I think what it really allowed people to do, Christine, is to understand that this is not going to be an easy issue to address because
Yep.
there are systemic problems that we have to overcome.
That's
Yes,
right.
there are the systemic issues that contribute to some of the clinical outcomes that we see that can result in deaths and even near deaths. I mean, we can talk about that as well, where there are women who, they don't lose their lives, thankfully, but they are significantly impacted or they lose their babies. So, to have Cheryl get in this launch and really tell the hard truths that we have to face if we are going to move this forward and eradicate these disparities was a wonderfully compelling, just, several minutes within this presentation that I sat there and my mouth fell open. I was just totally transfixed. She was a tough act to follow. Let me just tell you. But it was powerful on so many different levels. And I truly believe that anybody who is able to see that part of the launch, there were lots of great speakers, lots of people who gave us the charge, but also to see that historical context that we are all operating within, I think is so, so important. So it was a wonderful, way to kick it off. I think there were a lot of people who were really, really engaged. And I do believe, I felt the momentum. I'm sure you did as well. Whereas we're leaving, people were making sure they had the links and they were passing the flyer to make sure that they can start to get moms' input on it. But it was a wonderful, wonderful launch.
Absolutely. I would have to mirror the same. I was in the background there, kind of just a fly on the wall, so to speak. But Melissa, you did an awesome job bringing us the facts about the survey, and our speakers were excellent, just as she mentioned. We're going to include the link at the bottom. So make sure that you click on the launch link if you have not seen it already, so you can really get more depth about the survey and to learn a little bit more.
Right.
So one more thing I want to discuss, Melissa, is for a mom that is interested in taking and completing the maternal experience survey, how she can access the survey itself. So for PPI, we're going to have it open and available here on our page. We'll be posting it every week. Just reminding folks out there that it does exist. And can you tell us some other ways of where we can find the survey?
Yeah, so there are a few different places where you can access it. NAACP Atlantic City, of course, has this on their website. Prematurity Prevention Initiative, Christine just mentioned, it's on your website as well. There's several other places that you'll see in social media where you can be directed to. Here's what we're looking to do, though. We are not looking to have it just in one place. Anybody who's listening to this, if you go to those sites, if you are part of an organization, or you're just a concerned stakeholder in the community, find this link. There's a QR code that allows someone to be able to scan it and complete the survey at their leisure. You can start it, stop it, come back to it if you need to. If you didn't just give birth, but you've recently given birth and you really do want to share your experience and you're in Atlantic City or Atlantic County, get to this link and share it as much as you can on your social media. One of the things that Christine touched on, and thank you for bringing this up, is that, now is the time. We have so much wind at our backs right now. We have so much momentum. The First Lady of the state is really championing this cause through her Nurture New Jersey strategic initiatives. Now is the time for us to be able to come together in a different way, to use these resources that are available to us and get the word out. Get this survey in front of the Black mothers who've gone through a birth experience, but we need to hear their voices. The only way that we're going to make a change in this system is to hear from all of you. And I know y'all are like me, where I want people to know what you did wrong, but then also what you did right. So let's make sure that we get as much input as we can. So though it's on the NAACP Atlantic City site, it's actually on the Atlantic City, the web page for the city. It's there as well. PPI is going to be having it, but we want everybody to own this. This is not just for us. This is for all of us and all of our communities to make sure that your voices are heard. Black women are empowered to change this system that has affected them for so many years, especially here in the state of New Jersey. So definitely find the link and share it as widely as you can.
Absolutely, share it indeed. And for those that are tuning in, we also will include the link to the survey as well as the flyer, because we know that the voice of NJ Moms does matter.
Okay.
So Melissa, we're going to wrap it up today, but I thank you so much for taking time to talk to me for a bit this afternoon. And everyone out there, look out for the Maternal Experience Survey, the launch. It will be posted to this post. So make sure to share it and to try the survey out. Thank you so much for tuning in. We'll talk to you soon. Bye-bye.
Thanks, everybody. Bye-bye.